Hello and welcome back to the next chapter on Doodles MD, where you get simplified medical information in relatable and applicable form. I'm your host, Folake Lawal, public health, internal medicine, and infectious diseases physician. We're moving on to the new phase, a new chapter where we're going to be talking about diseases, okay? Common diseases, rare diseases, infectious disease of different organs and systems that we've talked about. Before we start on the topic, make sure that you have hit the subscribe button so you can know when our videos drop, and make sure you like this video at the end. Leave us comments and questions and we'll get to you. And we're going to move on to blood pressure disorders. First, what is a blood pressure? A blood pressure is the pressure that we measure on the outside of the body in the blood vessels of the turbulence that blood has when it's moving through the blood vessels. Remember, we talked about the pump in our previous video of the normal cardiovascular system. We talked about the pump. It squeezes and pushes blood out, and the blood goes through the tubes and the pipes, which are the blood vessels, right? So it's forming some movement, the flow, all right? The highest pressure you get when you pump out, that is your systolic, that is the upper number. When your heart relaxes, which is the pump, when it relaxes, the lowest number you get right before the next pump, that is your diastolic, and that measures how well the heart and the blood vessels relax to allow blood to flow. The normal is between 90 and 120 for the upper number. That's the systolic blood pressure, and between 60 and 80 for the lower number. When it's too low, there's problems because you cannot get enough blood to where you're going. Okay, imagine, when you open your faucet, your taps, and the water is just like, you're not getting in, and blood is essential to all parts of the body. When it's too high, obviously that turbulence and that excess force damages the organs. Okay, so that is the normal, that's the blood pressure. And there's stages of the high blood pressure. You have above 120, you have the elevated, you have stage 1, you have stage 2, you have hypertensive crisis as shown in the chart below. Who is getting hypertension? All over the world. Okay, adults between age 30 to 79, there's about 1.2 billion, almost 1.3 actually, 1.28 billion adults between age 30 to 79 all over the world who are hypertensive. And 2 out of every 3 are in low and middle income countries. Of course, countries like the United States have about almost 50%. So, when you balance it out with other developed countries, it may not be that bad on the average. Now, out of all the people who have hypertension, almost half, 46% of people don't know they have it. And that's serious because it's a silent killer. And when people even know, right, less than half of the people who know get treated. So imagine you have 10 people, 5 of them don't know. Of the 5 that know, maybe 2 to 3 of them actually get treated. So it's really a problem. Then when you take the people who get treated, the 2 to 3 who get treated, and then you take about 5 of them, only about maybe 1 to 2 people actually are able to stick to it enough to get their blood pressure under control. There can be 2 types, what we call the primary or essential, which is it's kind of inevitable based on some other factors, which I will get to. And there's what we call the secondary, which means there's something actually identifiable that's going on, like you have a kidney problem, you have hormone problem. When you go over some of our other normal videos, like when we talked about the adrenal glands, okay, producing cortisol, and when you have excess of those kind of things or other things, they can now cause blood pressure to be high. Okay, now also some medications or foods that people take can affect their blood pressure. Now primary is what we talk about the most. Okay, and in talking about that is that what really are the causes? Usually it's age. Age, you know, as you get older, your body is getting worn, wear and tear. You know, your heart has been working for God knows how many years, and it's maybe just trying and doing all sorts of things. And so age is a factor. Genetics also is a factor in terms of hereditary. So there's certain genes in people that just make them predisposed to having high blood pressure. So if any of your parents then the chances that you have it is higher than someone whose family doesn't have it. Of course, things like stress that causes the nervous system to be in overdrive and your body is producing excess of certain hormones like cortisol, forces your body to be in overdrive and can cause chronic hypertension. Weight, high weights for, you know, age or for body size and things like that can predispose. Of course, are there people who are overweight that don't have hypertension? Sure, they are, but it is a predisposing factor. Smoking, taking alcohol is a factor, and also consumption of excess. When someone is hypertensive, how do they know? First thing is, many people don't know, can't know till it causes problems over years, okay? That's why it's called the silent killer. Remember in the beginning I talked about half people who have it don't know they have it, okay? But when it gets really, really bad, like your blood pressure is very high or you've had it so long that it's damaged other vessels, you might begin to see symptoms. And honestly, once you start seeing symptoms, things have gotten way out of hand. So you may see things in people in having things like chest pain, okay? Their blood pressure just gets so high, their heart cannot get enough blood, and they're just having chest pain. They may not be able to breathe. They may be having palpitations, which is basically your heart beats is different. It's loud and it's very hard. It almost feels like your chest is going to tear out of your heart is going to tear out of your chest. Sometimes people have swelling in the legs. We call it peripheral edema, where that means that it's affecting the kidneys a little bit or a lot. You might be having headaches, okay? And that is also a sign where it's really affecting the brain. Blurring of the vision, where you can't see properly. Usually it's transient, and those are signs of what we call hypertensive emergency. What now happens if you don't treat your blood pressure is that it could affect the brain. People can have strokes. There's something we call vascular dementia, where small parts of the brain just starts dying off, and then people get what we call tiny vascular vessel damage, dementia, okay? And their memory just starts going bit by bit, okay? And they could just have major strokes also. Heart attacks, blindness, cardiac diseases, either heart failure or just ischemic heart disease, where the blood vessels narrow and they choke the heart because it's not getting enough blood pressure. Kidneys, other organs. And in women who are of childbearing age, when they're pregnant, also it complicates the pregnancy and makes it a high-risk pregnancy. Now, in management, okay, how do you manage it? First is obviously you have to identify what your own risk factors are. If you smoke, obviously stop that. If you drink alcohol, stop that or reduce it. If you take a lot of salt, usually, low salt diet. One of the strongest and biggest factors, like I said, is dietary modification. So at certain levels where it's not too high, the doctor can prescribe dietary modification 3 to 6 months and see how that goes. There's a dietary plan called DASH, okay, which is dietary approaches to stop hypertension. And it's a framework of things that recommends different kinds of things to eat and what not to eat to avoid, to help you hit your nutrition goals. And that is very good. Also, limiting sugars, de-stressing, relaxation, but ultimately, in many people, it's a lifelong diagnosis. In most people, actually, it's a lifelong diagnosis. And you just have to take your medications. All right, so thank you for staying tuned on today's episode of Blood Pressure Disorders, talking about predominantly hypertension and a little bit about hypotension. Next week, we're going to be talking about arrhythmias, which is abnormal, irregular heartbeats. Make sure you share the video with your friends, follow us on our other social media handles, and of course, I hope you've subscribed. Till next time, I'm Falake Lawal signing out on Doodles MD.